Good time of the day. We got an interesting question today, which is very important for all of us. What's the update on opioid epidemic? What's going on? We posted our first video around July 2019. We made presentation at Case Western in December 2019, Ohio Opioid Task Force around June 2020. Before that, we submitted several letters starting from 2015, business integrity concerns to some insurances in 2016, and so on. We've done some research with the National Academy, which is posted on our website, and made a publication in a peer-reviewed journal with Director of Drug and Alcohol Abuse in one of the branches of Cleveland Clinic. So how we see the situation, I'll try to answer this question, and it's not just my impression, emotions, but I'll try to come up with numbers and show you some trends.
Hi, my name is Shauna Thompson. I've been coming to Dr. McCollian's office for about a year and a half now. The staff and the doctor are very friendly. They really concentrate on especially my needs, on how to get me better and get me well. I'm currently in a powered chair, and thanks to him, I've been able to get up and take at least about 5 steps a day. So I am really grateful that I have met him and been coming here.
My name's Virginia Bowers. I have been coming to Dr. Margolin's for, about 2016 when I came here. I love this office. I love being Dr. Margolin's patient. They serve me well, and I'm feeling better every time they treat me.
My name is John Florallen. I come here almost 2 years, but I like it. I like the doctor service. I'm satisfied. I'm happy.
Hello, my name is Vicki Curry, and I've been coming to Dr. Mongolin for about 4.5 years now. And I am really happy to be here with him because he shows a lot of concern about my health, what's going on with me, and he gives me a lot of good advices and medications as well to help me. I appreciate the fact that I have him in my life. I don't know what I'd do without him. Thank you.
Hi, I've been a patient of Dr. Margolin's for 13 years, and he got me through all the hard times, and now that I'm older, he's still taking care of me, and I'm very happy with his service.
All right, so what's the update on opioid epidemic? First, I refer to the article published on our website. We'll also put a link in the reference to this video that we published, as I mentioned, with the director of one of the branches of Cleveland Clinic for Alcohol and Drug Abuse Services, and that covers pretty well the trend, the explanation. We also showed the trend, the graph from about 2010 till 2017, which showed a steady increase in overdose death. We pointed out several concerns related to this issue that, in our opinion, contribute to that. Some of them are correctable, such as less than perfect insurance policies and coverages, authorities, regulations spreading fear instead of cooperation, lack of funding, less than adequate mental health and addiction services, and an outdated strategy which tackles the ghost that existed 10-15 years ago when Ohio had pill mills, and the sole problem was, as authorities saw it, was overprescribing or inappropriate prescribing. So the people who are not physicians, who are either lawyers or politicians or police background, with the help of some kind of advisory board, as they say, try to regulate the field of pain management in Ohio as much as possible. And that started around 2011 with HB 93. I remember it very well, and I actually was a big proponent of HB 93, and still is to some extent. It helped to regulate the field, close pill mills, and I hoped at the time it should have an impact. It had a potential to improve Ohio overdose death. But let's see what actually happened. This is data from Case Western University. That's 2010. At that point, Ohio is at national average in terms of overdose death. It doesn't mean it's good. It means it's average. That's where the regulation starts. 2010, 2011, it kicks in. And surprisingly, instead of decrease, we see a steady increase of overdose death, to which peaks in 2017, as we mentioned in the article. At that point, Ohio is 2.6 times approximately the national average. So the situation, the more pain management clinics are regulated, doctors are scared, doctors are put out of business. And it may be justified. I don't know. I don't make any political legal statements, but we see that the number of overdoses keeps increasing. Now, there is an interesting thing happens here around 2018. There is interesting drop. It's not a sharp drop. We're still way above national average, but there is a drop of maybe 10-15% in overdose death in Ohio, and maybe nationwide around 2018, which was lauded and as a major achievement. Politicians took credit and they say, hey, finally it works. We were pretty skeptical at the time. I mean, I'm glad that the overdoses dropped, but you see that already next year, 2019, it starts to climb up, even before COVID. And with COVID, it's higher than all-time high. The estimate is 5,000 overdose deaths in 2020 in Ohio, which generally shows that the overall trend is up and up and up. And in the last part of this video, I'll try to come up with some ideas of what may be causing it and what may be done. Thank you. All right, so we see that despite best efforts of authorities, legal, political community, the overdose death in Ohio, and Ohio is one of the top 2 or 3 states usually in the nation after West Virginia. Some people say some years it's even highest number of deaths per 1,000 people. So why it didn't work? What is the reason? What's going on? So, well, if you don't understand the enemy, your military efforts may not be that successful. Again, the assumption is that it's only overprescribing, or mainly or 90% overprescribing. By regulating doctors, scaring them, maybe educated to some extent, you can fix the situation. And we see it's not working out for several reasons. First, regulations, as I mentioned in many presentations, don't fix medical problems. People who are lawyers, policemen or politicians are not trained to resolve medical problem. I'm not sure if they understand them completely. My experience communicating in writing and in person with some of them were not terrifically successful. It's like I always say, take the best lawyers, take the best doctors, board certified, published, and ask them to write a petition to Supreme Court. It won't look good because they're doctors, they're not lawyers. So the same thing when lawyers try to solve a medical problem, they may be very bright, and I assume they have good intentions, at least some of them. It's still not working out very well. Secondly, I still see big money and economic concern or interest in many insurance companies and many other bodies who talk about dollars and cents rather than human life. I have to admit I saw that, and that can be correctable. But beyond that, if it's not only overprescribing, not only doctors, what's going on? In my opinion, where even with best regulations, when you don't have good addiction services or good follow-up system or good regulation of illicit drug supply, when people are denied access to pain management programs, and maybe justified so because they have some issues, maybe they have aberrant drug seeking behavior or addiction, they don't have a place to go, or it's hard for them to find. And we worked hard, for example, to find places for our patients. Sometimes it's easier, sometimes it's more difficult. But what happens to these people? They go to the street. The street supply of illicit substances goes higher and higher and higher. And not only that, but the substances are different. They say that 120 years ago in this country, 1 in 200 people was addicted to opium. But we didn't see so many overdose deaths because it was opioid. It wasn't good, but it wasn't fentanyl. It was not fortified or enhanced artificial substance. What happens today? Not only that people are pushed to the street, and not only that they buy stuff on the street, the stuff they buy is very dangerous. It can be mixed with fentanyl, which is #1 killer, or with other substances, and they may not know that. And even the dealer who sells them this stuff may not know that. Giving you example, cocaine with fentanyl, almost not a problem. 2014 increase. If you look at today, it's a major problem, major cause of opioid overdose death. Methamphetamine with fentanyl, almost not a problem, right? 2014, major increase in methamphetamine death. Ohio methamphetamine death almost didn't exist, or not a big problem to 2007. Major concern today. It's not the prescription that the person picked up, it's the stuff from the street. And I personally witnessed people who lost their loved ones because they bought a joint mixed with fentanyl and so on. This is a trend. It's a major issue. We get more potent and more lethal substances mixed with other illicit substances on the street. People combine opioids with alcohol, with benzodiazepines. Ohio, unfortunately, has a major issue with overprescribing of benzodiazepines, in my opinion, looking at a lot of patients. And some of these issues can be addressed. Some of them are much harder to address. But as I mentioned before in our presentation, you need to switch from fear to cooperation. Some insurance and political changes need to be made. Until then, unfortunately, I don't have good news. It's getting worse, and we need to be extra careful. Watch our videos about how to talk to your kids, what is addiction, and so on and so forth. And I still hope that there is a way to improve the situation, primarily if there is a goodwill and reasonable leadership. Thank you so much for this question.